Hi guys, just wanted to check in. It's Dr. Preston with Beachside Naturopathic Clinic here in our lovely Sunset Beach office. And I just got compelled to just take a couple minutes because people are always asking me what naturopathic doctors are, what naturopathic medicine is. And a lot of people have been coming in with a lot of questions surrounding how we would treat certain conditions. So I just wanted to take this opportunity for one condition in particular because it's been on my mind and on a lot of people's mind is what we call nutritional psychiatry. So it's basically a holistic approach at looking at the brain. So the brain is kind of the one organ we don't look at. Doctors, psychiatrists, there's no really standard test for that. It's if you have heart disease or autoimmune conditions, you get blood work. You monitor your condition, you see what could be causing that. But when you come in with depression or anxiety or aggressive behavior, especially with kids and adults, we've been seeing a lot of that on the news. And we can't help but really strongly see the connection now, more and more research with that connection between nutrient deficiencies and these mental, emotional, and or neurobehavioral disorders. Mostly more prevalent in young kids and elderly over 50, but it can really apply to anybody. And we see it here all the time when we can do the testing, and that testing is nutrient testing. It's a little bit different than going to your regular doctor and, oh, your vitamin D is low. Well, that's great. That's a good place to start, but there are so many other vitamins, and there are ways that they interact with each other and ratios, especially for the brain, like zinc and copper. It's not just about having one or the other, whether you deplete it or not, but making sure they're in the right ratios, because they really do balance out certain behaviors, especially ADD. So anyway, we do this type of nutrient testing that looks at intracellular vitamins. So what is actually getting into your cell? There's a difference between kind of what's floating around versus what gets into the cell. Certain vitamins need to get into the cell. Certain hormones need to get into the cell. And so they play off of each other. So this nutrient testing you can usually find through a functional medicine doctor or a naturopathic doctor. So why don't you, if you know somebody that's really struggling, doesn't want to maybe get on drugs yet, it's not severe, or even if it is severe, we are really trained and equipped to handle that and look into that. There's a international organization of Nutritional Psychiatry.org. You can get a lot of resources there and look for a naturopathic doctor that deals with that. So give us a call if you have any questions, concerns about anybody. But just wanted to really reach out and let people know that is a really logical step to start with, for anyone that's trying to reach out and deal with any kind of mental, emotional issues. All right, thank you and have a great day. Bye.